Don't wait. Don't wait till you get in so much pain that you're using a walker or a cane. My name is Neil McCarthy, and I'm from Palos Heights, Illinois. For approximately a year before I came here, I was experiencing pain in my right hip. It was causing me a lot of discomfort when I was trying to sleep, lying on it, walking on it, curtailing a lot of my physical activity, so that's why I came over here. It got so bad that I was actually using a cane for the last few months before I saw Dr. Butler, just to throw the weight off from the bad hip onto the other side. Just very uncomfortable, taking a lot of anti-inflammatories and things like that to knock down the pain. And certainly curtailing a lot of my physical activities. I used to walk a lot and get outside and do things like that. And the pain prevented me from doing that. As I did a lot of research online about the anterior hip procedure, which I'd heard about, which is a much simpler procedure. The recovery time is a lot quicker, a lot less pain, you're weight bearing, you can bend at the waist, things like that. Things that I wasn't able to do after the first procedure by another doctor of the posterior hip. So I did a lot of research. Dr. Butler was the only doctor at Palos Hospital who did this procedure, and I wanted to go to Palos Hospital, so that's why I came to see him. I was worried because of the bad experience I had with the posterior hip 6 years prior. A lot of pain, a lot of discomfort for a long period of time, long rehab. And yeah, I was worried that the anterior hip might not be everything it was built up to be, everything that I read about it online. I was very happily surprised at the results and the lack of pain and the range of motion and stuff that I experienced post-surgical. So yes, I was very happy about it. I think the total time to be totally pain-free was about 3 months, but the pain that I had initially post-surgical was nothing compared to the post-surgical pain from the posterior hip that I had in 2006. So much less painful, much easier procedure on me, on the patients in general. I'd say within 2 weeks, actually within a week, I was driving a car again. I was walking with a walker for about 2 or 3 weeks, and then with a cane. I mean, just back and forth using one or the other, depending on which felt better on a certain day. And after about 2 months, I was off either one of them and just walking unaided. I started physical therapy about 2 weeks post-surgical, but I would say within 2 months I was good. Within 3 months I was great. He's an excellent surgeon, very personable, outgoing guy. Bedside manner is great. I mean, he really gets to know the patients and talk to them. At least that's been my experience. The staff here has always been outgoing, personable. He's a very knowledgeable guy, and his surgery, he's a very good technical surgeon, explains everything to you, makes sure everything fits and is measured properly. So I was just very, very happy that I met him, that I discovered him, and that he did the procedure for me. Well, certainly I'm walking now unaided with any device, you know, walker or cane. I can ride a bike with no problem. I can walk for a long distance. I usually do 2 or 3 miles at a stretch. Push-ups, sit-ups, things that were uncomfortable because of trying to get into the position, do the exercises. I do those now as well. So in general, just an active, normal lifestyle for a guy my age who has 2 prosthetic hips, you know. Anterior hip, definitely. I wouldn't even consider, I would never recommend a posterior hip replacement. This is the advanced, this is the easy way of doing it. The recovery time is so much quicker, less pain. You don't need a bath seat in the bathtub. You don't need a seat to elevate the toilet. You can bend at your waist. Definitely the anterior procedure. Dr. Butler, because I think he's a fine surgeon, because I think he's a fine, caring man. He called me probably 7 or 8 times at home just to see how I was doing, how the pain was, and things like that. A very personable, outgoing guy. So I wouldn't hesitate to recommend the procedure or the doctor. Don't wait, just get it done.